Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery, and all I do is perform cosmetic or aesthetic plastic surgery. I've been performing cosmetic or aesthetic plastic surgery in the Scottsdale Paradise Valley area since 1992. A lot of people come into me in their 30s and ask me, Dr. Shapiro, what procedures can I do or are available for somebody in their 30s to help make me look younger or to stop some of that more advanced aging processes? Are there things that are non-invasive? Are there surgical procedures? The answer to that question is there are many things that we do in this office, and I'll start out by talking about the non-invasive procedures. First of all, what's very, very common is Botox, and people feel as though these days that if you're in your 20s and early 30s, it's not a bad idea to do Botox. The reason being is that it's been shown to help minimize those wrinkles over time, so when you do get those wrinkles, they tend to be less deep and less active. So a lot of people come in their 30s and have Botox done, and that really is to reduce the wrinkles. With regards to if you have some folds or you've lost some volume, which happens as we age, there are some soft tissue fillers that are really phenomenal. You've heard them all. There's Juvederm, Restylane, there's something called Sculptra, there's something called Radiesse, and now there's something that lasts even longer than Juvederm or Restylane, which is something called Voluma. What's so great about these procedures and these fillers are that they're longer lasting now, they tend to be more elegant, and they give you control because you can really decide when enough is enough for you, and you can kind of postpone that and do it in a series that gives you that look that you're looking for over time. A lot of the changes that I see in the 30s have to do with skin texture and some fine wrinkling and discoloration. So there are many procedures that we do in the office, whether it be photofacial that actually decreases the irregularity of the skin pigmentation. It can help decrease the pore size and minimize the wrinkles. There are some laser resurfacing procedures that we do, micro laser peel. There's something called a 4-day peel that uses a micro laser peel along with a pro-fractional laser. So all of these things can be bundled in a fashion that is very comfortable for you and really minimizes the downtime, if at all. So I think the most downtime would be about 4 days for these procedures. But an ongoing care regimen, done in the office and also some home care products are the best way to approach aging in your 30s. When we get into surgical procedures, probably the most common things that I do would be something like having your eyelids surgically enhanced. What I mean by that is we get rid of the puffiness and the excess skin. That tends to be hereditary. So if you see bulges beneath the eyes in your family, your mother or your father, and you seem to have them, those are the people that tend to get them younger. A lot of times that as a result of the sun damage and smoking and whatnot, you'll see some of those changes in the eyes. So a blepharoplasty is something I commonly do for somebody in the 30s. As we go on, people again tend to lose volume in their face, and we tend to look a little bit gaunt as we age, and I see it in the 30s here. So fat transfer is something that I do quite commonly that takes your own fat. I process it, purify it, and re-inject it in your face to give you a long-lasting filler. So it's really a transplant, not a filler. So we want to see a permanent result there. And lastly, when we do get into more surgical procedures, whether it be combined with laser or not, there are things that I can do in the office that elevate the cheek, something called a cheek lift. And that is a variation of something I've created called a Gen X lift. But the best way to figure out what options are available to you in your 30s for your face, to figure out whether you're a candidate for non-invasive or more invasive procedures, the best way to get an idea is to come in, we meet and we talk about your expectations are, I talk to you about what I think can be done, and then we go from there. Thank you very much.